Hello, my name is Di and I'm a cardiac rehabilitation educator at ACHA. This short video will outline information to assist your recovery from cardiac surgery. Please remember that the information contained in this video is general advice only. You should always follow any specific advice and instructions given by your specialists. Recovery will vary depending on your operation, general health, age, lifestyle and fitness level before the operation. Now that you've progressed in your recovery and are about to leave hospital, here are some guidelines to reassure you about your recuperation and things to be mindful of during this time.
Your sternum will take approximately 12 weeks to heal. The first 6 weeks are the most important for the healing of the bone. For the 6 weeks after that, the bone will continue to strengthen and heal. Wires stay in your body for life. They do not rust or set off security alarms at the airport.
You may still have an adhesive dressing covering your wound. As it starts to gray in color and lift around the edges, you may remove it gently, preferably under a warm shower to assist with the release of any adhesives. Wash with warm running water and then gently pat dry. Do not apply powder, soap, or creams to your wounds. Observe for signs of infection such as pain, swelling, heat, redness, wound drainage or pus, odor, or fever. Please contact your surgeon if you experience any of these symptoms. Swelling at the top of the sternum is normal and will reduce in time. Avoid direct sunlight until the wounds have healed. Once healed, continue to avoid sun exposure to prevent sunburn. For the first 6 weeks, do not swim at the beach or in a swimming pool. Only recommends after 6 weeks or once wounds have healed. If you have arm or leg wounds, it is not uncommon for the arm, hand, and foot or leg to be slightly swollen and tender. This should resolve in time.
Everybody that has surgery has a different experience, and the pain medications that are prescribed to you by your doctor or surgeon will be different for everybody. They consist of a combination of medications to try and improve your experience after surgery, and generally short-term medications consisting, as I said, of a combination of strong medications for pain as well as everyday medications. The most important medication that you are prescribed and which forms the basis of pain control would be paracetamol. Paracetamol comes in various forms, which tablet forms and mini caps, which can improve your ability to take them. Depending on your surgical type and your surgeon, there are other agents which may accompany the paracetamol for use. These include tapentadol or Palexia, or oxycodone, endone, both of which are termed opioid medications, and these are designed to be used as a backup to the paracetamol through the day or night. The main issue with these agents is that they will cause drowsiness, constipation, and potentially some nausea. During your stay in hospital, you will be given those medications by nursing staff, and during that stay, they will, in consultation with your nursing staff and surgeon, you will be able to determine which one suits you best. As well as that, they can offer you medications to help you with some of those side effects, in particular with constipation. In addition to these agents, depending on your surgical type and the surgeon prescribing them to you, they may offer you a couple of additional agents which are extremely short-term and are designed to, again, supplement the use of the paracetamol. These include a slow-release version of Palexia or tapentadol, which differs to the immediate or quick-acting formulation which I mentioned previously, in that they are designed to be given 12-hourly, so twice a day. They form a background of pain relief and are sometimes prescribed where severe pain is expected early after surgery, and may continue to be offered for up to 1 to 2 weeks after the surgery so that you can continue to recover and rehabilitate. The side effects from the slow-release Palexia or tapentadol are constipation and sedation. Lastly, a small number of patients may also be given anti-inflammatory medication. The most commonly used one is celecoxib, which comes in a capsule formulation and again is designed to be given twice a day, and that reduces inflammation and is used to supplement those agents. The main concern with anti-inflammatories is that they can irritate the gut in some cases, causing reflux, and again that can be controlled with other medications if required. Generally people will remain on those for 1 to 2 weeks maximum after the surgery, just to reduce inflammation and help with their rehabilitation. Before you're discharged from hospital on these pain medications, it's important to ask the nurse looking after you when you had your last doses in terms of the time and potentially date, so that you can then determine when your next doses would potentially be due, so that you can maintain your control of your pain.
Atrial fibrillation, also known as palpitations, is common after surgery, especially for the first 2 weeks. If you experience an irregular heartbeat or palpitations and they do not resolve after rest, such as sitting or lying down, or they last longer than 30 minutes at rest, you should seek advice from your doctor or call 000.
It is normal to experience shortness of breath after surgery. However, this should continue to improve during your hospital stay and beyond. If you find your breathlessness persisting and not resolving with rest, or you're waking in the night due to your shortness of breath, or you need to sit up to sleep, you should contact your doctor the next morning. You may also notice swelling or fluid build-up in your legs. This can be normal post-cardiac surgery. However, this also will resolve. You should try to elevate your legs where possible and continue regular walking. If the swelling does not resolve, you should seek advice from your doctor. It may be helpful to weigh yourself alternate days during the week. The best time for this is usually in the morning, after your first trip to the toilet, and before you eat would be ideal. This can keep track of your weight and detect subtle weight gain. You must contact your GP if you put on more than 2 kilograms in 2 days and you notice that your clothes, such as your belt, pants or socks, are becoming tight. The swelling in your leg is worse, or you experience a sudden loss of appetite or increased shortness of breath. If you suffer from sudden shortness of breath, or cannot catch your breath, or experience new or similar type of chest pain or discomfort, it is always better to err on the side of caution and seek medical assistance by calling 000 and requesting an ambulance.
You will likely find that rest and sleeping should improve once you return home. Sleep in a comfortable position. Extra pillows may be helpful. Don't forget to take your heart cushion. It is normal to have feelings of anxiety and worry. You may feel flat, teary, and irritable. This is a common part of recovery and usually resolves in time. You will have good days and bad days. Please do not be discouraged. If these feelings last for more than a few days, please discuss this with your doctor. They are here to help. Communicating your feelings with friends and family can also be helpful. It is quite common after surgery to have blurred vision or occasional small bright spots in your peripheral vision. This will gradually improve. It is ideal to wait 2 months before getting your eyesight tested. Difficulty concentrating or feeling disinterested in reading or watching television may occur, but this is a common and temporary experience that tends to improve over time. It's a good idea to stick to lighter reading materials during this period.
The next section of this video is for those patients who have had an incision through their chest bone. We will also discuss how to manage and progress your exercises once you leave the hospital. This part is relevant for all cardiac surgery patients with either an incision through the sternum or the side of the rib cage. Here is how to safely get out of bed. Keep your elbows close to the side of your body. You can use a chest support if you wish. Bend your knees, roll onto your side, and bring your legs forward off the edge of the bed. Use your bottom elbow and top hand to push yourself into sitting. When standing up from the bed or a chair, aim to use your arms the least amount possible. Lean your upper body forward and press firmly through your heels. Only use your arms as required. If you need to use your arms to push up, ensure you use both together and keep them close to your body. It is very important that you support your chest firmly prior to coughing. Coughing exerts significant force on the chest wound. By supporting the chest wound, it will decrease pain and assist the chest bone to heal. Ensure your elbows are touching either side of your rib cage, and then gently press your forearms and hands across your chest. You can use a small support pillow if you wish. Apply pressure inwards to the side of the ribs, aiming to hold the rib cage together. Take a deep breath in, then cough. Exercise is very important for heart health. It improves your recovery and ability to return to an active lifestyle. Exercise makes your heart work more efficiently, improves circulation in your arteries, and lowers blood pressure. Aerobic exercise is one of the best forms of exercise to start with after cardiac surgery. It works large muscle groups as well as your heart and lungs, which will improve your fitness and endurance. Some examples are walking, cycling, swimming, dancing, and circuit training. Upon leaving hospital, you should start a walking program, ideally every day or at least at a minimum every second day. Start on flat ground, then progress to gentle inclines after 2 weeks. Avoid exercising during extreme temperatures or after a heavy meal. Start with small walks, about 10 minutes, then slowly build up to 30 minutes as you feel able. Once you have achieved 30 minutes, it is recommended to continue this most days of the week. Experiencing general fatigue, low energy, and mild shortness of breath during exertion is normal. However, these symptoms should gradually improve over time. It may be useful to track your exercise on a smartwatch, phone, or activity tracker to see if you're improving from week to week. Anything that you can pull, push, lift, carry, or do above your head will place strain on your chest. Remember the golden rule: if it hurts, don't do it. The physiotherapy staff will provide you with some exercises to commence at home.
Do not drive for at least 4 to 6 weeks from the date of your surgery. Please speak with your cardiologist before recommencing driving. When you've been cleared by your cardiologist to recommence driving, do not drive alone and take short, familiar drives until your confidence returns. If you drive a commercial vehicle, you cannot recommence driving commercially for 3 months and will require a clearance from your cardiologist. Please remember, when travelling in your car, for your safety, you are still obliged to wear a seatbelt. It may feel more comfortable to roll a towel or place your heart pillow between you and the seatbelt. During longer car trips, take regular breaks to stretch and paddle your feet. You may sit in the front even if airbags are installed. It is recommended to avoid flying during the first 10 days after your surgery. Please consult with your cardiologist or your surgeon before making any travel plans after heart surgery.
A healthy diet is an important part of managing cardiovascular disease. It is normal to have a loss of appetite in the initial days and weeks after surgery. However, your appetite will return. Smaller serving sizes or smaller portions more frequently may be helpful until your appetite returns. We recommend a moderate and varied diet that includes lots of fresh or snap frozen vegetables, fresh fruit, legumes, fish, and lean meats. Please limit salt, especially in the weeks after surgery, as this can encourage fluid retention. Weighing yourself a few times a week, usually in the morning after your first toilet visit and before you eat, would be ideal to maintain consistent and accurate readings. This can help you keep track of your weight and detect subtle weight gain.
Smoking and passive smoking should be completely avoided. Smoking is the quickest way to accelerate the risk of heart-related issues. Cardiac rehabilitation and the Healthy Heart program begin with in-hospital education covering your condition, procedure and recovery, extending support beyond your discharge. This program aids in your recovery post-cardiac surgery by offering support, exercise and education delivered by healthcare professionals. It can help you make long-term lifestyle changes for a longer and happier and healthier life. Through this program, our staff can provide support and guidance to boost your confidence in physical activity, offer advice on healthy eating and medications, and connect you with others who share similar conditions for mutual support and shared experiences. We can refer you to a program that is closer to your home if you live away from the metropolitan area. Our program typically commences around 6 weeks following your discharge from hospital and runs twice weekly for 6 weeks. We here at ACHA wish you all the very best with your recovery, and go live your best life.